pledge will be led by the gentlewoman from Texas, Ms. Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time, then, for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Eddie Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Eddie Bernice Johnson.
Hello, and welcome to the Capitol Report. My guest today is Dr. Mary Wakefield. She is the Administrator of Health Resources and Services Administration at the U.S. Department of Health and Human Services. President Obama appointed Dr. Wakefield to her position in February the 20th of this year. HRSA is what it's called, an acronym, is a federal agency that improves access to health care for Americans. It works to fill in the gaps of our healthcare system and serve people who are uninsured, isolated, or medically vulnerable. And just the same group we're talking about now for healthcare reform. Dr. Wakefield came to the Obama administration from the University of North Dakota, where she was a tenured professor, the Associate Dean for Rural Health at the School of Medicine and Health Services, and Director of the Center for Rural Health. In the 1990s, she served as Chief of Staff to North Dakota Senators Ken Conrad and Quentin Burdick. So she's had various experiences, and I know they needed her as a teacher because now we're looking for PhD nurses to teach more nurses. But she received her bachelor's degree in nursing from the University of Mary in Bismarck, North Dakota, and her master's and doctoral degrees in nursing from the University of Texas at Austin. Can you believe that? Got some Texas blood. So I want to welcome you to the show and tell you how much I appreciate you taking time to come out and answer some questions and tell us a bit about what you're doing every day, because we're working very hard on this healthcare reform. And we hope that finally we can get it done, hopefully, but it's not a done deal yet.
It's tough sledding, isn't it?
Yes.
Yes, and I know you've been working very hard. I understand even from your staff that you were in a lengthy meeting last evening, hour after hour, trying to push through and getting healthcare reform. Yeah.
When I go home, I'll be able to say I've read that 1,000 pages.
Page after page, line after line. Yes, you will. I know. It is, and you're right. It's a big challenge, but it's one of the most important things we could be faced with and working on right now.
And it's a great deal. People are getting false information, but, you know, that's what we live with up here. They pick out something and say it as a scare tactic. And this happened in 93 and 94, and I was here then. But we hope this time we will come out with a product.
It is so important to separate myth from fact, isn't it?
It is.
To try and help people understand what the provisions are so that they can make up their own mind.
Yes.
Yeah.
And the choices will be left up to the people of which provision they'd like to be a part of. So what is your role right now?
Well, as the administrator of the Health Resources and Services Administration, my role is to oversee a fairly large part of the U.S. Department of Health and Human Services. And it is a part of the agency that involves roughly 1,400 staff. Some of those staff residing in your district, in fact, in the regional office that's located in Dallas. And so the Health Resources and Services Administration actually employs people who live right in Dallas and extend the reach of the agency to not just Texas, but also to some of the surrounding states. So I'm really pleased to say we have a presence right there. They are our frontline folks who help us keep a finger on the pulse of what the healthcare issues are right in your congressional district, but even well beyond that and beyond the borders of that great big state, Texas. And so it's a large organization in terms of numbers of people who are employed there, and also with regard to the scope of activities. We do focus on ensuring access to health care for vulnerable populations. They may be medically vulnerable, so they're people with chronic conditions like HIV/AIDS. They could be geographically vulnerable, like the folks who reside in West Texas, for example. So at great distance sometimes from healthcare services.
Yes.
We have programs that target those populations. So they could be financially vulnerable. So we target programs that really reach out to meet the needs of the uninsured. And regrettably, that population, given the economic environment we find ourselves in right now, has grown by leaps and bounds, putting a lot more pressure on the programs that we operate out of the Health Resources and Services Administration. So it's an agency that focuses on wrapping a safety net, if you will, around people who are financially vulnerable, medically vulnerable, geographically vulnerable, to ensure that they too have access to high-quality health care. And we do that through a range of programs.
In Texas, it's hard to accomplish, but it's possible, but it takes a lot of people.
Yes, it does.
To get around our entire state. I recently had a town hall meeting on health care reform, a tele-town hall meeting, and the major questions that came in had to do with how are we going to take care of all of these people. We have so many new immigrants in, and they haven't had a chance to really get into a health care plan. Most of the jobs that they take don't really offer coverage, and many of, and you have to clarify it, many of the people think they're going to be getting free care and they'll have to pay for it. And I tried to emphasize there's no free care. It's going to be paid for in some manner by sliding scale or the programs that they choose to go in. So I think we'll be seeing less burden on our citizens than more burdens, and that's the way I interpret about the exchanges and hopefully the public option, so that they can be a part of paying for their own health care.
And the President has made it very clear that individuals should have a choice, as you're suggesting, through the exchange, so that people can choose their health plan and can choose their provider, can choose their physician. That's pretty fundamental in reforming health care. That people who like what they have currently can continue to keep it, and those who want to have choices will have choices. There are a lot of parts of the United States where there are parts of states that are dominated, for example, by just one insurance plan. And so you don't have a lot of choice. So this will hopefully help to expand those choices. And as you suggested, there are a lot of people who don't have access to health insurance, may have just lost their job, or they've changed jobs and moved to a position that doesn't have a health insurance benefit. And for those folks, having the opportunity to get care where they can pay on a sliding scale, a sliding fee scale, or pay with insurance coverage are features that are really important. Community health centers, for example, provide those opportunities. That's one of the programs that the Health Resources and Services Administration manages. And we have community health centers that dot parts of the landscape of Texas, for example. And those are really an important front line of primary care services, the services that keep people healthy, where they can go to get immunizations, avoid hospitalizations, get good physical examinations, that frontline care that focuses on health promotion and illness prevention for people who are insured, but also available for people who do not have insurance. Those community health centers have been